Hello, I'm Dr. Inman. This is a miniature lecture on feline hyperesthesia syndrome, or what we call feline skin-spinal reflex syndrome. Veterinarians and also practitioners have known for years that if area along the back or on the neck of the kitty cat is actually stimulated, it'll cause a spasm of the muscles of the back to spasm, and the animal will start twitching uncontrollably, and sometimes that condition will recur itself as the twitching begets itself, and it'll be described that the animal is in some sort of seizure-like activity. Although it's not a seizure, it's actually a spasming phenomenon that's occurring. What's interesting, it can be very severe in the kitty cat. Very commonly, the cat will basically whip its head around to the left side, for some reason the left side, or also they'll lick after their left shoulder. We've seen that over and over and over. And so when we try to treat that, we can treat that with a number of different conditions, essentially, and we treat that with a big blast of corticosteroids, which will cause it to go away for 3 to 6 weeks. And that's fine. However, we can't keep giving these kitty cats medication for 3 to 6 weeks for the rest of their life. The fact of the matter is, if an anti-inflammatory can reduce that particular symptomology, then it is an inflammatory lesion that's occurring in the spinal cord. And it is something that we call feline skin-spinal reflex. It can be so bad that the animal will actually, the hair will fall out, or they'll pluck their hair out, or they'll end up with feline miliary eczema, essentially, like millet seeds under the skin, essentially, because that whole skin area is compromised neurologically. Lack of blood supply, lack of nerve supply will produce all kinds of problems associated with this. One of the ways that we take care of this is we go through and we adjust it, and we find out the animal reads all up and down the spinal cord. Virtually every time we pulse this animal, that we get a pathological reflex. And by the way, the kitty is not happy about being adjusted. It's uncomfortable, it causes spasm, and it actually hurts. It doesn't feel good at all. And so what we'll very commonly do too for these animals is we'll use a series of frequencies that are designed to treat care of spinal problems in the spine and skin. And we treat the skin-spinal disease with this particular type of approach. And this has been more effective as a means to solve the problem as opposed to postpone it with an anti-inflammatory. We use the frequencies of 151, 1151, 153, and 1260, 1550. Those frequencies are commonly used as a means to try to calm down and repair and rehabilitate neurological function all along the spine. And we can get rid of this particular problem over a period of about 3 to 5 weeks, essentially, and never have to see it again. It is a solution for feline hyperesthesia syndrome, which we have also dubbed as feline skin-spinal reflex syndrome, essentially. Veterinarians all know about it, essentially, and we see animals that have that condition. If the animals respond to corticosteroids for a while, that's fine, but it always comes back. We fix it with this technology. We show that actually extensively in the basic and advanced laser courses that you'll find on the VonTech.com website, and also how to utilize the adjusting device as a means to take care of this condition. The adjusting device by itself can theoretically take care of it, but it takes a long time, probably about 20 VOM procedures. But when we use the laser therapy, essentially with it, we can get rid of the problem in a very short period of time. We found out that these animals are suffering from ingestion of toxicosis in their environment, in their water, and so very commonly we'll put this animal on hydroxybutyric acid. That's hydroxybutyric acid, which is in fact a product that we don't sell, but we'll show you how to go about getting it in this particular product. Put them on this, put it in the diet, they'll eat it. You just open up the capsule and put it in the diet, and they'll eat it, and it detoxifies. It takes the heavy metals and toxins out of the fatty tissue that surrounds the nerves in the paraspinal area, which is where this problem is coming from. So a combination of hydroxybutyric acid, laser, and VOM basically can fix these animals, even the ones that are as nasty as, for instance, this one. This has been a lecture on the feline hyperesthesia syndrome, or feline skin-spinal reflex syndrome. Thank you, and have a great day.